So the first step is review the chart for any limitations in physical activity. Then, identify the patient and discuss the procedure with the client. So, good day ma'am. I am Karen Perlayuba, your student midwife for today. May I know your name po, please? Age, address, birthday po. Ma'am, I will be assisting you po for bed bathing. Is it okay to you po ba ma'am to take you po a bath? Then, assess the patient's ability to assist in the bathing. Then, assess the patient's personal hygiene preferences. After that, close curtains around bed and close the door of the room if possible. Adjust the room temperature if necessary. And then perform hand hygiene to prevent the transmission of nosocomial infection and put on gloves and or other PPE if indicated. After that, gather the necessary supplies and bring to the bedside stand or table. Offer patient a bedpan or urinal. And then remove gloves and perform hand hygiene. Let's assume to adjust the bed to a comfortable working height, usually elbow height of the caregiver. Then, put on gloves. Lower side rail nearer to you if possible, and assist patient to side of bed where you will work. Have patient lie on his back or her back. Place bath blanket over patient and then remove top sheet while patient holds bath blanket in place. If linen is to be reused, fold it over a chair. Or place soiled linen in laundry bag. Take care to prevent linen from coming in contact with your clothing. After that, remove patient's gown and keep bath blanket in place. If patient has an IV line and is not wearing a gown with snap sleeves, remove gown from other arm first. Next is raise side rail. Then, fill basin with a sufficient amount of comfortably warm water from 43 to 46 degrees Celsius. Change as necessary throughout the bath. If possible, lower side rail closer to you when you return to the bedside to begin the bath. Then, put on gloves if necessary. Fold the washcloth like a mitt on your hand so that there are no loose ends. Then, with no cleanser on the washcloth, wipe one eye from the inner part of the eye near the nose to the outer part. Then, rinse or turn the cloth before washing the other eye. Use a separate corner of the washcloth for each eye, wiping from inner to outer canthus. Rinse and pat dry. After that, wash the face. Ask the client or patient about preferences for using soap on the face. Next is wash neck and ear, rinse and pat dry. After that, you can also ask male clients if they want to be shaved, assist if needed. Expose patient's forearm and place towel lengthwise under it. Using firm strokes, wash hand, arm, and axilla, lifting the arm as necessary to access axillary region. Then, rinse if necessary and then dry. Then, place a folded towel on the bed next to the patient's hand and put basin on it. Soak the patient's hand in basin. Wash, rinse if necessary, and dry hand. Just repeat actions in number 23 to 24 for the arm nearer you. An option for the shorter nurse or once acceptable to back strain might be to bath one side of the patient. Move to the other side of the bed to complete the bath. Next is spread the towel across patient's chest. Lower bath blanket to patient's umbilical area. Wash, rinse if necessary, and dry chest. Keep chest covered with towel between the wash and rinse. Pay special attention to the folds of skin under the breast. Next is lower bath blanket to the perineal area. Place a towel over patient's chest. Wash, rinse if necessary, and dry abdomen. Carefully inspect and clean umbilical area and any abdominal folds or creases. After that, return bath blanket to original position and expose far leg. Place towel under far leg. Using firm strokes, wash, rinse if necessary, and dry leg from ankle to knee and knee to groin. Wash, rinse if necessary, and dry the foot. Pay particular attention to the areas between toes. You can also repeat actions from step 29 to 30 for the leg nearer you. An option for the shorter nurse or once acceptable to back strain might be to bath one side of the patient. Move to the other side of the bed to complete the bath. Make sure patient is covered with bath blanket, change water and washcloth at this point or earlier if necessary. Then after that, assist patient to prone or side-lying position, put on gloves if not applied earlier, and position bath blanket and towel to expose only the back and buttocks. Wash, rinse if necessary, and dry back and buttocks area. Pay particular attention to cleansing between gluteal folds and observe for any redness or skin breakdown in the sacral area. And if not contraindicated, give patient a back rub. After that, raise side rail if possible, then refill basin with clean water. Discard washcloth and towel, remove gloves and put on clean gloves. After that, clean perineal area or set patient up so that he or she can complete perineal self-care. If the patient is unable, lower side rail and complete perineal care. Then, help patient put on clean gown and assist with the use of other personal toiletries, such as deodorant or cosmetics. Next is protect pillow with towel and groom patient's hair. And then change bed linens. do aftercare, and perform hand hygiene to maintain cleanliness. Then lastly, document findings in patient's chart. That would be all. Thank you po.